Make and let's cut your light. This should work. Yeah, so we got
working slideshow mode. So it's already or at least it thinks it's on.
Let's see.
There it is.
Okay. Yeah, sometimes it's just
okay.
Tell me what you see, Michael.
Yeah, I see the presentation well. It looks good.
Presentation.
You want me to put this like the presentation directly on this computer so I can put it to Zoom that way?
That might end up being better off.
Yeah,
for
that has some time of visuals and movies and so.
Let's see if we can do it.
Yeah.
Let's see.
Let me actually grab a USB.
Yeah.
For my
We might be able to make this happen.
Yeah. We'll just do it. See well, just see kind of a grainy VHS level.
Good afternoon, ladies. How are we doing? Can't complain.
Everyone, thanks for attending. We're trying to
yeah, it's kind of a weird setup. Part of me wants to move it, part of me is like kind of lazy, like just let it sit like this. Right?
Yeah, I'm just
Nah.
Then I was like, oh my god, I basically just broke my neck. Yeah, oh my god. But I did.
See. You're saying we can USB it to not computer, then just have the Zoom. That would be great. Because otherwise, I was gonna have the phone set. Because what I've had, you probably haven't seen the other setups. I've definitely had like the phone setup and kind of sort of just following around.
There you go. Let's get the people what they want.
Sure. What's happening, gents? What's happening? Hello, hello. Grab a seat if you can.
All right, let me grab
Sure, of course, absolutely.
I got my talk right here. You have a USB-C or not have an adapter? Oh, yeah. Great.
Yeah. This is good. This gives me one less thing to do. I'm still going to recording, but I can just do it from my phone.
Let's see. There is our.
Are you getting the old amyloid plaques?
Oh, a little bit. A little bit. Let's see. Where is sorry, basically, where is where is the where can I access the USB?
It should be it should be like a connect thing.
Maybe that's
the
no, it's what's this one right here? That's Cloud Sync.
It's a OneDrive.
There's a device right there, but I think that's the eject one from PC.
That one. This is
there
weird.
Oh, maybe we can try it like this. Use the PC and watch it.
Yeah. There we go. It's the plan. Hello, sir.
Hi. Ah, that's Reiner. How's it going? Good to see you. Let's see. USB.
Mr. Reiner, are you pursuing an MD?
I'm not, but this is a former student.
Yeah, Mr. Reiner. I think this is your first year teaching, and I just transferred to Harvard Westlake. So yeah.
So it's interesting because so what year did you graduate?
07.
7. I've been there a couple years, but
there we go.
I
Got it. Okay.
I couldn't find. I searched for your name on my computer and found like a comment that I wrote.
Yeah.
When you were a sophomore.
Yeah.
And it was all about how disciplined you were. And
yeah.
and it was really funny to read.
Yeah.
But obviously you figured some things out.
Yeah, sure did. Yeah, I remember we butted heads a few times.
Pretty kind of disorganized.
Yeah.
Story, basically.
Yeah. That's actually normal for surgeons. We're very easily distracted. But yeah, no,
That's normal for surgery.
yes, we have like squirrel attention spans.
And that's why you want to, you need a job that focuses you so much that you can't.
Yeah, exactly. If I have to write a paper or something of that sort, I am like most procrastinating. Like basically probably some sort of subclinical ADD, but unless it's like 5 minutes before the deadline, then it just magically gets done. But that's been like my MO since Harvard Westlake. Yeah, I was not a good student at Harvard Westlake.
So wait, do you actually do like drug development stuff?
I do a lot of things. I'll go over. I do drug development, and I'm a practicing neurosurgeon. Yeah. So let's see. I want to make sure we're on the Zoom that people can see my screen. Here we go. Share. Presentation. Here. Okay, there we go. I think everyone. Great. Okay. We have something. Michael, are you able to see the slides okay? Sorry, you're the only one I'm seeing right now.
Yeah, it looks great. It's in the presenter view for me, but that's all right.
Oh, it's in the presenter view. Okay. How do I do it next? The
Oh, yeah.
display settings, maybe? Just do mirror display. Duplicate slideshow. There we go. How's that? Still presenter?
Oh, that's perfect. Yeah, it looks
Beautiful.
excellent.
Okay.
Thank you.
Yeah, no worries. We'll make it work. Yeah, I'm just waiting for the green light from Ozzy. Okay.
This works for you, Bob?
Yeah, it works perfectly. I think they're seeing the presentation as needed on the Zoom, so.
Perfect. 110.
Yeah.
What do you want to sign?
Whenever you tell me to. We're giving the green light.
I said when we get 10. 8, 11. You want to start?
I can start whenever you guys tell me to.
Okay,
Or if
let's
you want
do
to
it.
wait more. Okay, sounds good. Okay, guys, we'll start. Nice to meet everyone. I'm Dr. Vladimir Ljubimov. You can call me Vlad, Dr. L, Dr. V, however you want to pronounce my name. I respond to everything as long as I figure out it's me. So I was a student here. I graduated in 07. Actually, Schreiner was my chemistry teacher my sophomore year when I transferred here. So it's nice to be back, and thank you so much for having me. So now I'm a practicing neurosurgeon, and I'm a physician scientist. So kind of want to tell you a little bit about my little talk here today. First off, I'm going to tell you a little bit about my career as a neurosurgeon and what neurosurgery entails. Then I'll kind of give you a little synopsis of my journey from Harvard Westlake to becoming a neurosurgeon, kind of what I did along the way to get there. And then the last part of the talk, I'm going to focus on how to pursue medicine and what my recommendations are to kind of get you guys a step ahead and kind of learn from my mistakes that you guys won't repeat them. So first, what is neurosurgery? Is it what Marvel and our favorite medical dramas show us? As much as we'd like to think so, not always. First off, we're not that good looking and we don't have magical powers, although we do some pretty cool things with the brain that some people think we have magical powers, but that is far from the truth. It's all science and engineering. So here are real neurosurgeons. There's Dr. Henry Marsh, a famous British neurosurgeon who wrote a very famous book called Do No Harm, which I'll talk. This is Dr. Sanjay Gupta. He's a CNN correspondent, but he's an actual practicing neurosurgeon. And here's some of my colleagues, Dr. Ross, Dr. Chan, Dr. Tay. I trained with them. We are colleagues. They're Dr. Ross and Dr. Chan are spine surgeons. Dr. Tay is a functional neurosurgeon, which I'll get into in a little bit. So we are normal people. We just took a long time to study. And how long did it take me to get here? So college, 4 years, medical school, 4 years, residency, 7 years, fellowship can be 1 to 2 years. And then some of us are so masochistic, we like to get a PhD and master's or something along the way. So we're in the school at least to the 27th grade. So yeah, it's a long road. And here's a classic neurosurgery graduation picture. Yeah. So yeah, to put it in perspective, I trained after graduating from Harvard Westlake as longer than most of you are alive currently. So Yeah, it's a long road, but is it worth it? And of course, I'm a little biased since I survived hell to get here. I think it is. I really love what I do. And let me tell you a little bit more about what neurosurgery really is. So neurosurgery is basically surgery of the central nervous system. And that, because nerves are everywhere in the body, we're kind of the last surgeon that can go literally everywhere in the body without extra subspecialized training or going to a different field. But that said, neurosurgery has a lot of subspecialties within it. So some of the classic ones is neuro-oncology, where this is the taking out brain tumors or spinal cord tumors, or even sometimes tumors in the peripheral nervous system. There's also vascular surgery, where we clip aneurysms. The old school, we put these metal clips on an aneurysm so it doesn't bleed. Now it's a little more high tech. We actually do it through a catheter and advance it intra-arterially and just put platinum coils and basically block off the aneurysm. And here's actually one of my colleagues blocking off an aneurysm. Is going under IR, and the computer makes this 3D render of what the vascular system of the brain is, and you can see his catheter in real time go up there via an X-ray, and then with some scaling, this is the picture you get. And you can see in real time as he's putting in coils to make sure the aneurysm is being occluded and the rest of the circulation is not being occluded, so you don't get a stroke. There's also pediatric neurosurgery, where we deal with disorders of the nervous system in pediatric populations, where we primarily focus on the operative side, where our neurology colleagues kind of helping us from the medical side. There's spine surgery, where we operate on the spine. We sometimes share this a little bit with orthopedic surgery, but here's for example, a scoliosis correction. You can see straightening the spine. You can do fusions, you can do decompressions, take out spinal cord tumors. This is functional neurosurgery. And you see this often in the news where people have, for example, have a movement disorder like a tremor or a Parkinson's disease. And for example, they were a musician when they were younger and they can't play their guitar, like Mr. Reiner can, because they develop a tremor. So what we do is we actually do these surgeries awake, and we stimulate the part of the brain. We put an electrode deep in the brain under navigation to get to the exact point where we need it to. But the navigation's off by maybe a millimeter or two. So we kind of trial it, and we basically stimulate it, and we're talking to them live. We ask them to draw shapes, or if they're a musician, we ask them to play the instrument. They're awake playing the instrument and telling us feedback, no, my hand's not still tremoring. We turn it on a little harder. We reposition the electrode, oh, my tremor's gone. Great, that's where we lock it in, and we turn it on, keep it there. So that's just one of the examples of functional neurosurgery. This one's actually probably the most instant gratification surgery you can get, because you fix the patient right on the table, and they tell you that. There's also peripheral nerve surgeries. The nerve system just is not just the brain and spinal cord; it goes everywhere. So, for example, you have any nerve injury like carpal tunnel, everything. We can fix that, do decompressions, or even more complex like nerve grafting surgery. Then we can do endoscopic neurosurgery, where we go through working through a camera. And for example, this is actually what I'm specialized in. Is I do pituitary surgery and endoscopic skull-based surgery. These are this is a cadaveric picture. Here's your pituitary gland. Here are your optic nerves merging into the optic chiasm. These are your carotid arteries that are merging here. And this anatomy, this is all about 1 centimeter thick, but some of the most critical anatomy that keeps you alive right here. So, it's really cool, elegant surgeries. And we do these before you have to basically open the skull up completely, go through the brain to reach this area. Now we go through the nose, endoscopic. There's no scar. Even though these surgeries can sometimes take 15 plus hours to do, patients do really well. We opened up, and then the classic more open skull base, where we can literally take off most of the skull, manipulate the brain to kind of get to the base of the skull. And why it's separate subspecialty is because the base of the skull is where all the cranial nerves and all the major arteries to the brain are. So this is the most valuable real estate in the nervous system. If you mess this up, you can get a catastrophic stroke, or the patient can even die on the table. So these surgeries, the approach to kind of get to this area takes so long. And also you want to make it cosmetic, because this is someone's head and face. So you have to make sometimes these really big openings behind the hairline to reach something around here. So you don't make a scar on their forehead. But you do some really cool stuff here. And that I can't see. I apologize. Yeah. Okay. Hopefully it is recording. Yeah. If not, I'll just be back next year and do it again.
Yeah, it should be recording.
Okay. Perfect. Thank you. Yeah. So these are kind of the subspecialties in neurosurgery. And of course, there's neurosurgical trauma, where we deal with head injury, spine injury from, for example, motor vehicle crashes, trauma, gang violence, you name it. And these are some of the most acute ones where you have to react really quickly. You have minutes to save someone's life because if you don't decompress, like for example, a hematoma in someone's brain right here, it's pushing the brain off to the side and crushing your function. If you don't do this within a certain amount of time, they stroke out and they lose function or they can even die. And sometimes, of course, the traumas are irreversible, or same thing with spinal cord injury. If you don't operate on it quickly enough, they stay paralyzed or they lose function. So because this, like, it is a little bit more of a high stakes field. It's the longest training for a reason, but you do some of the coolest stuff from this. And kind of some good books about neurosurgery and medicine in general that you guys can read up, kind of get a little bit more of the stories. And first one is Do No Harm. It's a very classic book by Dr. Marsh. It's a very famous book that they basically required reading in all medical schools. Then like When Breath Becomes Air and When Air Hits Your Brain is a little bit more nuanced, kind of more if you're interested in neurosurgery itself. It's talking about like, though When Breath Becomes Air, I think is a really good one. It's a doctor who became a cancer patient himself as a neurosurgeon and kind of talking about how being on both sides of the knife. And then of course, the most famous of them all is something called House of God. This is a book from the 70s. It is the most inappropriate, raunchiest book you've ever read, but all medical dramas are based on this book. This is the catch-22 for medicine. This is exposed like resident abuse in the 70s and how like instituted a lot of our like training restrictions because it just showed how brutal medicine was to its trainees and kind of the behind the scenes of medicine, how terrible it is, the whole like affairs in the supply closet, like all that stuff. This is all from this because the reason residents were called residents is because you physically resided and lived in the hospital. You did not leave the hospital. Like you're basically an indentured slave for a few so many years. And you did this voluntarily because otherwise your career is smoke. So yeah, medicine is used to be, and sometimes still is, a very toxic place to train. That said, sometimes it is a necessary evil because if you don't put hundreds and thousands of hours to do this, you don't know how to work under pressure in the middle of the night and you can lose patients. So, but yeah, highly recommend this. However, one caveat is from one of my classmates in medical school is we had to read this over winter break on our first year of medical school. He decided to play as an audiobook on his road trip with his family. It opens very graphically, so do not recommend. Yeah. Okay. So here's some picture from the OR. Here's me, and we're doing a complex surgery. We're doing a cranioorbital tumor that's partially extending to the eye. So we have our ophthalmology team and our neurosurgery team working together. So let me tell you a little bit about my journey into neurosurgery. And I'll be kind of highlighting some of the, I think, the important steps that helped me get to where I am today, starting at Harvard-Westlake. So I was Harvard-Westlake class of 07. I took 7 AP classes, and I highlighted the science ones, and it's kind of the STEM ones below. Back then, that was pretty average for Harvard-Westlake. And then I volunteered at Cedars-Sinai since age 13. I just kind of did like the teen volunteer program there. Just there's multiple programs, USC, CLA. Got some clinical exposure and got to know some doctors. Here's a picture of me when I was around 13 years old. I did some extracurriculars. I was piano is probably where I shined the most compared to like on a Harvard-Westlake scale. I was a pretty average water polo and swimmer here on the teams here. And back then they also had a jiu-jitsu team in the off season. So those were just fun extracurriculars. But they'll actually all came in handy, and I'll kind of tell you how. But then eventually graduated Harvard-Westlake and went to college. So I went to USC. Actually, it was a spring admit, but then I used my fall semester to go to community college and take out all my general ed classes. And together with that and AP classes, I actually got all the units I needed to basically cut off an entire year of college. And I only completed college in 3 years total with only 5 semesters at USC. I actually tested out because I got really well on my APs. I got 5s on all of them, of all the science classes for my major. That said, medical school makes you retake all of them. They don't count your APs if you test out of them. So you have to retake. But that was the easiest A's I ever got. I slept through all my classes, and like the professor's like, "What are you doing? Why aren't you paying attention?" I was like, "I can teach this class for you." And after a few back and forths, they realized I could. So they let me kind of do my homework on all the assignments. I didn't actually have to do any work outside of class. So yeah, basically, as terrible and hard as it is at Harvard-Westlake, it's actually very easy afterwards because this place over prepares you a little bit. And I think I got a C in Mr. Reiner's class in chemistry, just saying. And then I got like straight A's in all my college chemistry classes, including like physical chemistry, all these inorganic chemistries, because it was just a joke after that. So just saying that I was a very average Harvard-Westlake student, but I'm here now. So it's not, like I said, it's all about persistence, which we'll get to. But during college, I also worked in a research lab. I worked with Dr. Croniopharyngioma. She works in Alzheimer's disease. So this is actually the subject of my undergraduate honors thesis. And I studied glutathione acetate and how it affects basically primes the immune system to attack the beta amyloid plaques and hopefully treat Alzheimer's disease. And we got some good publications out of it. And another good thing about is basic science is both it's a blessing and a curse. It's very slow to publish anything. So actually all my publications that I got were actually close to time I was applying to residency in medical school. But at that point, it really padded my CV quite a bit. And then just in college, so I had 2 summers. Between high school and college, I actually worked in a research lab. I was actually 17, so I couldn't do some of the cool experiments. So I was basically organizing files, being like basically a free summer intern for them. But because I put in the work, as soon as I turned 18, they're like, well, great. Why don't you continue some of these projects? They hooked me up with some great things. You put in the work, you kind of show up, and people decide to give you opportunities. And then between year 1 and 2, I took a summer class of physics that I already kind of tested out of, but needed to repeat for my med school applications, and then continued to work in the lab. And then between year 2 and 3, I took my last physics class over the summer, and actually took all my summer classes at community college because they were $200 per class as opposed to $4,000 per summer class at USC. So another thing is keep that in mind. They're the exact same classes, but you save a lot of money. And then I took the MCAT, which is basically the medical school equivalent of the SAT or ACT, and it's universally required for all medical school applications, with very few exceptions, which I'll briefly touch on later. I graduated with 3.83 GPA, got a 35Q on the MCAT, which is the old scoring system. I'll kind of, when I talk about that test a little bit in depth, I'll explain the difference. But basically, 95th percentile, which is generally considered very good. You're essentially said, okay, you're going to get into medical school. They also, my GPA for science, all my science class was 3.78 and 3.9. So there's no weighted GPA in college. It's all over 4.0 scale. Got some awards, Phi Beta Kappa, Magna Cum Laude, and random awards. So that's kind of what I was the meat of my application for medical school. And like I said, after Harvard Law, this is not hard to achieve at a college. You'll be surprised how easy college is going to be after this place. So, however, my MCAT score came back late. So I took that at the end of the summer, and I got my score in September. So the applications were open since June. So I was already kind of late to apply. So I decided instead of going straight like 3-year college medical school, and applied that right away, I took a gap year. And I worked in a research lab as a lab technician. And I actually worked, again, at Cedars-Sinai. I couldn't work with Dr. Coronia lab because she was not hiring, but she was a good mentor, and she gave me some good recommendations to Dr. Melmet, who's a pituitary endocrinologist. And I got to work with Dr. Shostakova and actually Dr. Adam Mamalak, who's a pituitary neurosurgeon, who's trained me through my residency, has been a great mentor to me, and now is my senior partner. And Dr. Zhao. And again, we looked at pituitary tumor senescence. We looked at how neuroinflammation affects neurogenesis and apoptosis of neurons. A lot of good basic science stuff, and got a lot of publications out of it, again, that came out more in medical school. And because I already had this set up, I did really well as a lab technician. I was very motivated. I got great letters of recommendations for medical school. And they also let me work in my summers in medical school and to continue working as both like a technician, but essentially like a graduate student. So they let me get me a lot of good opportunities. So like I said, long-term investment in research or some activity and some networking really pays off. Here's a photo of my last day in lab before I went to med school. Then comes the medical school application. So I'll tell you, I applied to 24 schools. I got secondary applications from all. Again, I'll explain all these terms in a minute. And actually, as I mentioned, I was a good pianist. So I sent a video of me playing piano to medical school. Every advisor said, oh, that's a stupid idea. Never do that. As you know, as Dr. Reiner said, I'm very bad at listening to directions. But I decided to chance it. This is back in the day when YouTube was just in its infancy and like nobody did this kind of stuff. Like if you wanted to send something, you sent it like a CD. So I was like, well, I did this for a friend. They asked me to record something and I put it like on YouTube. And I was like, oh, wait, I have a link. Let me just throw it into my application. Literally the next day I got like multiple interviews, and this is like the talking point that all my interviews were interested in. Because I mean, you're competing against the top of the top when you're applying to medical school. Everyone has good grades, everyone has good scores, but they always look for something a little bit different on top of that, which we'll get a little bit. So that actually helped me get quite a few interviews. I got 9 interview invites. I only interviewed at 8 schools because I got some acceptances. So I didn't go to Dartmouth, who was later in the cycle. And then I got accepted to USC, UCSD, Northwestern, and Cornell. And then I actually chose USC again for financial reasons. I got to live at home, which while in college that sucks. In medical school, huge bonus to live at home when you have parents helping you out, because the amount of work you do in medical school, just to put it in perspective, 1 week of medical school classes basically encompasses an entire semester of college class material. That's how fast paced it is. So you're just, you're reading day and night. It's all about rote memorization and just work. It's 8 hours of lecture every single day in the first 2 years. Just straight lectures, all these top science topics, and like there's no break. It's like that, anatomy lab, and then once a week you go to the hospital to learn how to talk to patients. So medical school is very intense. And that's why there's such a high competition to get into that, so many hoops to jump through, because they're looking for students who can survive that rigor. It's not an easy road by any means. But ultimately, USC gave me a good, also a nice little program that they've had a pilot program for kind of combining medicine and engineering. So I could have pursued a engineering master's along with my MD, which I always wanted to do engineering, but because I wanted to graduate college faster, an engineering major, you could not graduate in 3 years. A biochemistry major, you could. I decided like I always wanted to try engineering as well. So that was a really good opportunity. So medical school, as I mentioned, this is something called a white coat ceremony. When you first start medical school, they give you your white coat, and it's like a whole ceremony. It's like you're now being kind of inducted into the medical world. And so medical schools, you have some minor differences, but you have 2 essentially years that are preclinical, where you kind of learn all the theory. So it's basically a continuation of like college. You're basically just sitting in a lecture. It's a very intense lecture. They teach you all physiology, pathology, anatomy, everything. And then I did it concurrently with some engineering courses, because this program kind of wanted you to create an engineering device, pair you with PhD engineering students to kind of, and so we had a startup company that actually launched that we did. Ultimately, it failed, but we got pretty far. We won it's our first competition that we won, got some seed funding, and with a couple of my colleagues from who are PhDs engineers, and one Pam Marr is a general surgeon now. But that was something, again, that was a wonderful experience, and something that I now design medical devices on my own. Because I went through this, it helped kind of teach me how to go that route and kind of go also into the business and development world. And then continue to work with some research. Then you have something called the USMLE Step 1, which is called the United States Medical Licensing Exam. It's a 3-part exam. And basically the Step 1, again, recent change, it now is pass-fail, but before it was scored, and the score basically decided which specialty you can apply it to. If you did really well on this, you can apply to like the more competitive specialty like neurosurgery, plastic surgery, dermatology, ophthalmology, basically the higher paying, cooler specialties. And if you did really bad on that, you had basically kind of choice of less competitive specialties. All really important too, but just like less desirable, like primary care and so forth. Yeah. And then our rotations. I'm getting some echo here. Oh, sorry. No worries. Got it. And the core clinical year is when you do all your required rotations in medical school. So you do like 6 weeks of like general surgery, internal medicine, pediatric, OBGYN, like family medicine. And that's like your core year where you have to do all the general. And this is kind of where you get really exposed to, you're basically being like an intern. You're helping out the residents and interns deal with the service. You're seeing all the procedures. You're taking care of the patients on the wards. And then between my 3rd and 4th year, I took a year off to finish all my master's classes for the engineering, because I did essentially all the electives through that device design program. But I just did the core engineering classes and also concurrently finished some research up. And then my 4th year, this is your 4th year, essentially you kind of do only things oriented toward your subspecialty. So I decided to commit to neurosurgery. And so I basically took like multiple rotations in neurosurgery across multiple hospitals in the country. Also, this is kind of like your interview. So you want to go to these programs that you potentially want to get a residency job at. And you kind of basically have a month-long interview by working on their service and hoping that they think you're a good fit and that you're competitive enough. And then when you're done, as me graduating from an engineering degree, you tend to get a lot of graduations in this field. And then we have something called match day. So essentially, when you apply to residency, every program you interview, you pick your first to last pick, and every program that interviews people, they pick whoever they like the most and so forth. It gets all submitted to this national registry, and an algorithm basically matches you to whatever program that is the optimal fit between program and applicant. And there's a whole day, it's called match day, where you get an envelope and you see where you're going for the next 3 to 7 years. Yeah, and you sign a contract that's a binding agreement that wherever you go, and you may not get your first choice, you may get anywhere in the country, but that's how it's decided. And then we have our graduation, and then you're now a doctor. You have your MD or DO or whatever other medical degree you have, and everyone starts calling you doctor, but you're unfortunately very far from it. You know all the theory, but you have no idea what to actually do. And this is where the medical dramas get it slightly right, with like deer and headlights on your first day. Yep. Sorry, go ahead. Yeah. I'll go over all that in depth. I'm just kind of giving you a little flashback. And then also during medical school, I worked with Dr. Keith Black. He's the chair of neurosurgery at Cedars-Sinai, and now was my boss in residency, and now my boss in as my practice. And we did a bunch of interesting basic science research with him for drug delivery and designing nanopolymers that can cross the blood-brain barrier. This is the research that I've kind of taken over, and now I'm kind of directing this research myself, which I'll kind of talk briefly. But this is towards the end of medical school where I kind of committed to neurosurgery. I wanted to kind of go something more neurosurgical, so I started focusing on basically drugs against brain tumors. And I'll show you some videos and kind of talk a little bit more about this. But then comes the residency application. And this is to all specialties. You can apply to as many programs as you want. It's only one application. You pay per program you apply, so it can get very expensive the more programs you apply to. And so you can create a rank list, which I already touched on, and then you have match day. So that's kind of residency applications in a nutshell. And then you have residency. So for me, it was 7 years. I actually matched into Florida, in University of South Florida in Tampa. A pretty good neurosurgery program there, but that was not my first choice. But fortunately, a spot opened up at midway through my training, and I transferred back because I had really good relationships. Basically, the professors there and the surgeons there. I worked in their lab for many years. So they said, oh, yeah, absolutely. We'd love to have you. So that's where I finished my residency. Neurosurgery residency is a special hell. It's the longest and the hardest residency of all of the residencies. And to put it in perspective, I had the equivalent duty of 6 to 10 internal medicine residents on a daily basis. Because I sometimes have to take care of 70 patients at once, where a medicine residence was usually maximally capped at like 5 to 10, depending on their year of training. And from day one, they're like, great, here's the list, here's 70 patients, now make sure they all stay alive. And that was a junior residency, while the senior residents were all in the operating room operating. So residency is very difficult. We work days and nights, sometimes doing 24-hour calls. I've been up for like 48 hours once operating nonstop on a weekend. And that's normal, even though they're supposed to, it's quote unquote not allowed. You're not supposed to exceed 80 hours per week. That's a myth. Like sometimes you can't stop. Like, oh, my shift's over. The patient's like actively bleeding. You can't just walk away. Like, so training is very hard. Neurosurgery is the longest and hardest training. But again, like I said, the breadth of neurosurgery is so expansile, and the stakes are so high that you have to be really good and have to survive all that training to be able to do what you can do. And then I decided to subspecialize in something called skull base, which I mentioned, endoscopic and open skull base. So I did my fellowship with Dr. Fernandez-Miranda. He's considered one of the best endoscopic surgeons in the world right now. He's at Stanford. Spent a year with him. He's a great mentor, great friend, taught me a lot about surgical technique. He's actually operating a brain tumor under a microscope with him standing over me and giving me some pointers. And that really helped me, again, advance my career. And actually, I got to teach residents, medical students, and college students, even high school students at Stanford. So that's I definitely enjoy teaching that. But anyways, fellowships, again, this is something called subspecialty training. And it's different for every field. Some are very competitive, some are not competitive. Like in neurosurgery, not everyone does fellowship, because we did 7 years of residency. You can do almost all of neurosurgery right off the bat, and it's an extra year that you're have to default on your loans. So some people say, screw it, I'm just going to go into private practice and start making money. But if you want to do certain things, like pediatrics, for example, is required fellowship. Vascular neurosurgery is also required fellowship. Other ones are a little bit more kind of open-ended to this point, but that's going to be subject to change. And then other things like from internal medicine, like cardiology, GI, endocrinology, all those you have to do a fellowship for those. And it could be a match system. It could be like more like a handshake deal where you hold multiple acceptances. So those are a little bit more disorganized. But as a fellow, you can technically practice independently in your general specialty. So when I was at Stanford as a fellow, I actually had attending privileges and I got to work at one of the trauma hospitals, and I covered like call there and did all the basic surgeries independently there during fellowship, like I do now in practice. But for the complex surgeries that I did with Dr. Fernandez-Miranda, I did obviously under his supervision. So that's kind of that in a nutshell. And now currently I'm an assistant professor of neurosurgery at Cedars-Sinai. I work at Cedars-Sinai and their satellite hospital at Torrance Memorial, and I do all my research at the main campus in Cedars-Sinai. And my research, I focus on nanodrug design and delivery that crosses the blood-brain barrier to treat brain tumors such as lymphoma, glioblastoma, metastasis. Also doing some projects on pituitary tumors. Also doing the same thing for drug design for Alzheimer's disease that uses the nano cross directly into neurons, kind of merging some of my research paths. And currently applying for NIH funding. And again, I hope my government doesn't deem my projects and cut funding, but that's basically what it is. And let me just show you a little bit of videos. So this is actually our previous generation of our polymers. Basically, here's us trying to demonstrate how we treat cancer. These are checkpoint inhibitors. Video playing or quick time not available. Okay. How about next one? Oh, this one works. Okay. So this is one for breast cancer, where HER2 positive breast cancer is one of the number one breast cancers that metastasize to the brain. So cancer can spread to different parts of the body. When it spreads to your brain, that's really bad. That's kind of the end game there. And it's really hard to treat disease in the brain because you have something called the blood-brain barrier. Brain has a separate, like, kind of protective layer that doesn't let everything from the circulation pass into it. So we designed these drugs that can cross the blood-brain barrier directly and in a very targeted fashion, that they enter your bloodstream and they cross the blood-brain barrier and can deliver anything we want to across it. And we deliver something called checkpoint inhibitors, basically stimulate the immune system to attack these tumors. The checkpoint inhibitors basically inhibit these checkpoint T regulator cells that kind of suppress the immune response against the tumor. The tumor kind of tricks into hiding it. And basically it says, okay, free reign. You can fire on this tumor all you want now. And it kind of triggers a natural killer cells and cytotoxic lymphocytes. And basically lets the cancer cell be attacked by the immune system. And then on top of that, the second part of this drug is it goes directly into the cancer cell with a targeting mechanism. And the cancer cell tries to digest it. If you remember from your bio, you have the endosome that tries to digest the cell's components. It drops the pH, makes it more acidic, but that triggers an endosomal escape unit on our thing to be dissolved and released and causes our drug to break up in the endosome. But as soon as that endosome escape unit breaks out, it lyses the endosome and releases the drug inside the tumor cell specifically. And what we put in is miRNA, basically antisense mRNA that binds the tumor's mRNA and basically attenuates, in this case, c-MYC, which is an oncogene, and basically suppresses the tumor's growth. And that's how we do this like multi-pronged attack and kind of design these complex multi-stage nanodrugs. And this is something that we're hoping eventually to get into clinical trial. We're doing some great research, and our drug falls apart and becomes non-toxic. Another very important thing, that some drugs have a lot of side effects. We're trying to minimize that by making our drug. And basically it just kind of shrinks both the tumor and works both in the systemic circulation, like in the breast cancer itself, and also in the periphery in the brain. And then we do also these for lymphoma and for brain tumors, glioblastoma, which is a very deadly brain tumor. So this is what I do now. I'm a neurosurgeon. I do the surgeries for these tumors, and then I also work on designing some of the drugs because surgery is not everything. Some of these tumors, you can do all the fancy surgery you want, but they keep growing back, so you need to do kind of a combined attack. That's the beauty of like my field. I get to do research, I get to do surgery, I get to work with patients, I get to teach. So I think I do some really fun stuff, and it took a while to get here, but it's really nice. But is great. I blabbered on about my career and everything, but how do I get here? What are the real tricks? So for starters, what the hell is pre-med? That's something I had no idea applying to college. I kept looking for a pre-med major. Pre-med is actually not a major. It's a track. And you can be any major. You can be a violin major and be pre-med. All that means is that you have to take certain prerequisite classes to apply to medical school. There's slight variations between schools, but essentially it's 2 years biology, 2 years of chemistry, 1 year of physics, and 1 year of some sort of calculus statistics, and then some random humanities major or requirements, like some writing, some critical thinking, like philosophy class, essentially, that a lot of things that fulfill those other small requirements that you basically are forced to do in your general eds by most colleges. You do need to complete a major and graduate college. So basically, do whatever the hell you want in college, as long as you take the appropriate classes, you'll be golden. You can apply to medical school. You can be an English major, you can be a theater major. As long as you do your pre-med classes, you can apply to medical school. Most people do a biology major, for example, or like a biochemistry or chemistry major, because usually it just incorporates all those classes already into your major. So it's kind of just, so you don't have to take additional classes on top of your major. But so those are the classic pre-med majors. But that would have been nice knowing when I applied to college, because I kept trying to check off and I couldn't figure out which one I had to apply. I was like, write essays, which track I choose, or which like school I choose within the school. And they showed me all these things. I'm like, I don't care about like Marxist philosophy or something. These are all these random required classes, or like, I don't know, some random ethics class I had taken. Like, those are the variations between the different schools, and I had to write essays why I would get into these colleges and so forth. And I was like, I don't know. So, because I kept looking for a pre-med major. So just FYI, don't focus on getting into a pre-med major. Every college offers it. Focus on trying to get into like a track that has some interest to you outside of the medical realm, and that's going to help you a little bit. Now, what if you decided to do medicine, but you're almost done with college or you graduated college? So there's a few options to that. There's something called post-baccalaureate MD pre-med programs. Essentially crams in all of pre-med into 2 years, and you can do that as like an adjunct. There's a lot of schools that offer these programs. It's basically a 2 years intensive pre-med only program. So you do all the pre-med required courses. So I had some friends who were like an English or history major, or some people who did like business and finance, actually worked in the real world for a little bit. And then it's like, you know what? I want to be a doctor. This is what I was actually interested in the whole time. I hate my job currently. And then they decided to do these courses. Also really good, for example, if you kind of tried pre-med early on in college, didn't quite like it, didn't take it as seriously, got bad grades, dropped out, did your other thing, and then decided, you know what, I got a little bit older, I still want to consider this. This is another way to kind of repeat your pre-med, if as long as you didn't fully take all of it, and you might pad your GPA that way. And then there's different types of medical schools. They have complicated or confusing names, but allopathic, or basically that's the school that gives you your MD or medical doctorate degree. This is the traditional medical schools. There's also osteopathic, or they give you the doctor of osteopathic medicine. They teach complementary therapies, some like herbal medicine, like acupuncture, chiropractic type things, on top of the standard medical curriculum. And these are less competitive, but recently they have been, you can fully apply to any residency out of a DO school as you would through an MD school. Generally not bad, but if you're going for something ultra competitive, such as like the surgical subspecialties, or like dermatology, you have a little bit of a stigma and you have a little bit of a disadvantage. There's also international and Caribbean medical schools, and these are a little bit more of your last resort. That's if you did pretty bad and this is your last chance. They're a little bit predatory. They're definitely for profit. Their curriculum is like $100,000 a year easily. And they admit like crazy amounts of, like, especially the Caribbean school, someone like admits 700 students, but by the second year, they failed out half the class. So it's not like they're trying to keep you there. It's all they generate, and they basically train you to do really well on your board exams. It's basically it's like a test prep center for a few years to do really well, so you can get high enough scores on your USMLEs to be even remotely considered for residency applications. Because you're counted as an international applicant, and and then some people also do schools internationally, like in other countries. I know some people did in Israel and so forth. Unless it's an agreement that the school officially counts as a U.S. medical school, you're going to be at a huge disadvantage to apply for residency, because in the U.S., residency are given first priority to U.S. graduates in the U.S. Otherwise, a lot of international graduates would take all the spots for medical doctors, and almost all medical schools internationally are free, and we have crazy amounts of money to pay for our medical school. So like no one in the US would ever consider a medical degree if it was open to, if we didn't have some protection for a job. So that's kind of how working in the US or medical school works. And then there's also some combined programs that you can apply directly out of high school to. These are extremely, extremely competitive. So you basically get a guaranteed medical school admissions upon starting college. Again, I was completely oblivious to the existence of these programs, but I was probably not competitive to get into them in the begin with. They probably still make you take the MCAT. Some of them actually waive it. But you have to get basically a minimum score of this and minimum GPA during your undergrad time there. And you're basically guaranteed admission to the medical school. You can still apply out, but it's much easier because you're already basically compared if you had to apply again outside, even if as a student at that place. And actually, some of these are accelerated. You can even do this in 6 or 7 years as opposed to 8. There's also a lot of 8-year programs. So again, this is very competitive, but I definitely had a few of my colleagues who actually from Harvard Westlake who got into these combined programs. And a few of them actually, we went to undergrad and med school because they were USC used to have one of these programs. So what do medical schools want in an applicant? And this is kind of my pizza analogy. You have kind of the essentials, your dough, tomato, sauce, and cheese. Just bear with me. I know there's many options, but without that, it's technically not a pizza, so to say. And that's your MCAT and your GPA. If you don't have good scores, you're going to be screened out because at the end of the day, they're looking for a student who can survive the rigor of medical school. Then you have the topics. You want to have a good pizza. You have your research, your volunteering, your job experiences, clinical experiences, other degrees, letters of recommendation, applying on time, which I'll kind of cover a little bit of all of these. And all of these are very important to kind of set you a little bit apart from your competition because at the end of the day, all top medical schools, everyone's going to have really good scores, really high scores, kind of like what you're experiencing right now to like the top colleges where you guys are applying to. So the GPA, again, they care a lot about this. And they also split your GPA. Most medical school looks both at your science and like math GPA or your STEM GPA and also your non-science GPA. Generally in colleges, it's much easier to get good grades in non-science classes. Basically, because like I said, there's less competition. The professor is not trying to weed anybody out. And it's like I said, if you put in a little bit more effort like you would in a science class, you pretty much guarantee an A in most kind of non-science classes. Versus science classes are very rigorous. They're designed, there's a lot of pre-meds, high competition, high curve, because kind of the more competitive students pursue those. And you want to have good grades in both. You can't just have like, oh, I have like a 3.9 something non-science GPA, but I have like a 3.2 science GPA. That's not going to look good on your application. And then you have the MCAT, which is called the Medical College Admission Tests, required from Walsh Medical School. They have a current scoring system of 472 to 528. I guess they're big fans of the Fahrenheit scale or something of that sort. Don't ask me how they made those numbers up. The median score is 500. You want to get 517 plus. That's kind of the 95th percentile. That's kind of like you're in. There's 4 sections, again, fancy names, but essentially a bio section, kind of mixed in organic chemistry, a chemistry section, chemistry, physics, kind of like more mathematical section, critical reasoning skills, essentially reading comprehension. And now they also have this kind of like biopsych ethics section. This is a new addition in the last iteration of this exam. The exam's long. It's probably close to like 6 to 7 hours. It's painful, but your board exams at the USMLEs are 9 hours. So get ready. And you can take this exam 3 times in a testing year, 4 times in 2 consecutive years, and 7 times in a lifetime. My recommendation is take it once and get it over with. Just study for it seriously. Don't just like, oh, I'm just going to wing it. Like I'm going to give it a shot. Because sometimes the medical school will look at all your scores. So you don't want to like do badly on it and just kind of give it like a college try. Study for it. There's a lot of good prep classes like Kaplan does thing. You also have the MCATs, which is kind of their official practice MCATs, which are kind of sometimes they recycle those questions. Like those will give you very good approximation of your real scores. And you should take all those tests and make sure you know how to like time yourself. It's an endurance race. It's a long test, kind of like everything in medicine. Everything's a marathon. Very important. Do well here, and even if you have a slightly suboptimal GPA, you have a really good MCAT. You have a pretty good chance of getting into a good medical school. Now, research. Medical schools really like research. It shows commitment. It shows that you kind of have an interest in the field, and medicine basically survives on research. That's what drives progress in medicine. So, and then research mentors can write really good letters of recommendation. And one important thing that I stress to all applicants is know your research. Know what the hell you were doing in the lab. Don't tell them, oh, I just ran a Western blot or I did like a gel or something of that sort. You have to understand your project. Like, what were you trying to look at? What was the goal of the whole overarching project that you were a part of? If you can't say that and you fold on that during the interview, you're done. Like that basically shows me like, okay, this person has no idea what they're doing. They're just there for some little extra credit checkpoints on there and pad their resume. And I've definitely had applicants that I was interviewing and I asked them like a simple question about their project and they had no idea what the project was even about. And unfortunately, those applicants didn't make it. So that's one thing. Always basically know whatever you're submitting to any medical school, residency, college, etc. You have to be fully accountable to know everything that you've written there, and you be able to clearly talk about it and justify that I know what I'm talking about. I did this, and I am part of it. That is just universal in all fields, but medicines especially, they're pretty harsh about this. Volunteering, also pretty easy to get, shows commitment. And it's a great way to start getting clinical experience. And you can actually start doing that in high school. There's a lot of all the hospitals or the major centers, they have team volunteer programs. And sure, like you're not going to be doing awesome jobs. You're not going to be operating. You're going to be filing patient charts. You're going to be answering patient phone calls so nurses can do more important things and actually do patient care and like things of that sort. But that's kind of how you get your foot in the door and actually kind of start getting into your clinical experiences. And a lot of these clinical pre-med shadowing programs require like 200 hours of volunteering experience to even be able to apply to those. So it's a great way to start, great way to meet people, and again, good ways to get good letters of recommendation. Now, clinical experience is shadowing. I think this is something that you all need to do before you commit to medicine. This is important. Is truly figure out if this is for you. Like, what if you say, oh, I want to be a surgeon. You go into the OR, you see blood, you pass out, and you're like, oh God, like, it's not for me. Like, it's important to know. I mean, I'll be honest, I passed out the first time I saw blood in a surgery too, but then I was like, you know what? The second time I didn't. So it's not, sometimes you see things like everyone, like even like seasoned doctor, like, oh my God, like, it's like, you have those moments. You see things in medicine that you're like, you can't make this stuff up. So, but you definitely want to make sure this is for you. And also you want to see a doctor practice. You want to see how it works from day to day and kind of get a picture of like, not just like the concept of medicine, but just the day-to-day life. Like it's not always just like, oh, I'm going to do like something in a TV drama. I do like this crazy surgery, save this person's life. There's also a lot of paperwork. There's also a lot of dealing with insurance companies. There's a lot of like things of the job that is not as glamorous. And you have to kind of be able to experience that to see what your real job is. First off, gives you great insight into the profession, materials for your application essays, and letters of recommendation from your mentors. And because I shadowed certain types of doctors, like I shadowed a neurosurgeon in high school. And guess what? He was an awesome mentor, and that's probably why I decided to pursue this field. So sometimes getting paired with a really good mentor is what's going to determine what career you choose in life. And that's something I hear from all of my classmates and all my colleagues. They chose their field, their specialty, because they met a mentor who really resonated with them, like, and made them interested in the subject and showed them how awesome something is. So if you find that mentor, you'll be lucky. That's what you want to strive for. That said, these programs are very hard to get into because there's a lot of pre-meds, especially in a city like LA. There's basically 3 big centers like UCLA, USC, Cedars-Sinai, and the wait times can be sometimes a year. You have to apply like a year in advance for these programs. So if you're planning to do this, like you don't want to do this like a month before your medical school applications due. You want to start doing this like your first year of medical school, first year of college, and you're like, hey, I'd like to apply for a summer research. Especially most people do these programs during the summers. So be sure to apply like at least a minimum a semester in advance and like basically say like, hey, I'd like to apply for this program. Because at the end of the day, you're in the hospital, you're dealing with sensitive information, you're dealing with patient data and so forth, which is highly classified, protected. Hence, you actually need to do a lot of coursework. Before that, they have to go through a lot of orientations, like safety training. Those take time to schedule. So that's all things. Medicine moves at a snail's pace in some of the regulatory standpoint. So those are all things to keep in mind that you want to do ahead of time and not just do them kind of last second. And then job experience. So sometimes people work before medical school, can be in research, can be a non-medical field. Some people work as like EMTs or paramedics. First off, it looks favorable and again, gives you a real world experience. It makes you mature a little bit more. It takes you out of the student bubble because life in the real world is very different from school and gives you a little bit something to talk about. Other degrees, some people get a master's degree after college, like an MPH, Master of Public Health. You can do Master of Science in Biology, Chemistry, Engineering. Again, good if your college GPA is bad or if you're genuinely interested. And some people finish their major in 3 years and just take their 4th year of their undergrad and basically finish a master's. I've had a few people do that. So, and then Letters of recommendation. Essentially, you need 3 of your professors to write a letter of recommendation for you. You want 2 science and 1 non-science one. And then you can, they also recommend some additional. I had 5 letters. But again, if you do really well in a science class, meet with the professor, talk with them, get to know them. And once you finish that class, get a grade in it, that's when you ask them to write a letter of recommendation. Don't ask them like 2 years later because they forgot who the heck you are. I mean, somehow Mr. Reiner remembered me. But the college professors, they deal with these auditoriums like 300 students. They never interact with a student unless you make the effort to come up to them and talk to them. So that's important. Show initiative, build rapport with your professors, and those are the people who will write your letters of recommendation. And they can write your letter of recommendation your freshman year, but it'll just be sealed and given to your like pre-med or like graduate admissions office, and they'll just hold it there for the next few years until you apply. So that's highly what I recommend is don't wait for those. Get those early. Like if you did like really crush the class, did really well, and the professor and you kind of came into the teaching hours or something, like the professor knows who you are, just not just like a name on his like grading sheet. That's the person you're going to want a good letter recommendation. Additional letter recommendations that can be really defining are like the physician you shadowed, your research mentor, your boss at work, for example, if you took some time to work. So those letters carry some weight too. And then also you have like your personal statement. Okay, and then applying on time. So another thing. So medical school applications are a 3-stage process. You have the primary application. This is your common application. This is where you submit the same application to all the medical school. You basically write all your extracurriculars. You write your personal statement, which is kind of like why you want to be a doctor. Do not say I want to help people. That's super generic, basic. You want to have a legitimate, compelling reason, at least can in some way convey that in writing. This is where you submit your transcript and your MCAT scores, and this is kind of the screening. And it's very important to submit this on the first day it opens. This year, for example, it's opening on, I think, May 28th. Sorry, my monitor is video's blocking the. Move this to the side. I just realized the whole time it's blocked half the slideshow. There we go. It's May 28th. But basically, med schools are on rolling admission. So the first applications that get submitted on May 28th, they get to the admissions office first as the first batch. They review those, send out the additional applications, interviews, and basically those spots are already filled up. So it's more and more competitive and harder to get into medical school the later you apply in a cycle. I have people who had good scores like me who applied like 2 months or a month afterwards. They got into like barely one low-tier medical school, even though they had scores that were competitive enough for high-tier medical schools. And I have friends who had slightly lower scores than me that applied on the first day available, and they got into like really high-end medical schools. That little difference can change everything. Then every medical school will send you a secondary application. Some screen, so like some just send it out to everybody, and that's where you kind of write the supplemental essays. The schools, a lot of them are boilerplate and repeat between medical schools. You have to just make some tiny edits to make it specific to the school. Again, you want to submit these quick. Usually, the old turnaround was recommended 2 weeks, because some schools gauge interest. And again, it's a race against the clock, because the ones who submit it faster, their application gets processed faster. And they're like, oh yeah, we have like only 10 applicants to look forward to because they got here first. The committee is meeting. Oh, well, these 5 match our criteria, have good scores. They got their essays. Let's invite them for interview. And your interview is the final stage. It can be virtual or in person. And usually at this point, it's like a 50% acceptance rate if you made it as an interview stage. It's either some schools, basically you're accepted or waitlisted. And this is mainly just make sure you have no red flags. And then some schools, of course, make you jump through hoops. They have like these like mini interviews where they basically do like a speed dating type, like 15 minutes for like 10 faculty. And they ask you like an ethics question in one place, and they give you like give you a puzzle in another room and things of that sort. Some schools do that. Otherwise, it's just like a little like 2 people give you like a little chat with you, like, hey, tell me about yourself. And the 3 interview questions you just have to have down on the spot for every school you interview is, why do you want to be a doctor? Tell me about yourself, and why do you want to come to that school? You have to have a very well prepared answer for that. Rehearsed, but not sounding like rehearsed. You want to make it sound genuine. But I usually rolled in like, tell me about yourself and why do you want to be a doctor? Kind of give them a little bit of my life story and kind of merge that into one answer that I knew like cold. I can like recite it in the middle of the night if you told me at the time. And then you also want to have at least a logical reason why you want to go to that school, that besides like, oh, I'm interviewing at Stanford. I want to go there because it's Stanford, or Harvard because of the name. Like that's a legitimate reason, but that doesn't make you look good. you want to have like a legitimate thing. Like, for example, oh, I grew up in this area. I have family here. Like I have like a ties to the geographic area. Like this program, like look up some of the faculty at the school. Like this faculty person is doing something that I'm interested in. Like give them like a legitimate, compelling reason why you want to come to that school. That will help you a little bit like separate you like, okay, this person's actually interested in the school. Because sometimes you have these super high competitive, like ultra high scoring people, but like in the admissions committee, we discussed, we're like, what's the chance of this person actually coming here? Like, do we want to waste an admission on this person? Because we know they're not going to even show up here if we give them the offer. So if you give them a compelling reason, like, oh, my family lives in the city. I have like an uncle here. Like, I love this place. Like, or like I've been researching with this professor. Like that gives them like, okay, this person has some ties here. They're actually going to probably come here. So we have good reason to offer them admission. Like things like that. Some of them are very subjective, some are objective, and you kind of want to make sure you line up all your ducks in a row to optimize your chances. So becoming a doctor is not always being smart or being the best student. It's about persistence and never giving up. It's a marathon with severely delayed gratification, but it doesn't hurt to work smarter. It's hard enough as it is, guys. Like this is not a easy road, but it's probably one of the most rewarding careers in the end of the day when you make it, because for all the hundreds of cases where you feel like you could do nothing, there's always one or two that you've really made a difference in a person's life. And that's what kind of lets you sleep soundly at night, knowing that you did something good in your life until the ER wakes you up in the middle of the day again. So that's pretty much all. Thank you very much. My almost 2-year-old, Leo. And yes, it's possible to have a family in medicine, contrary to popular belief. And yeah, my wife, I met her the summer before medical school. So yeah. So thank you very much, everyone. Thank you. I know I yammered for quite a while. I have a lot of you guys so much information, but fire away, ask me any questions.
Michael, do you want to go ahead first since you're more of a priority?
Oh, no, I have time. Go for it.
Oh, okay. Hi. Thank you so much, Doc. That was super helpful. I'm a parent and I also advise my niece. She's applying to med school right now. So let's say you don't get the ideal MCAT. You get, what was the score? You said 7 something, 7, 10. Let's say you
17.
get.
Oh, yeah, that's what I was told is the new, like the good score. I mean, somewhere around there. It doesn't have to be exact, but yeah.
Let's say you get I think the 750, 710. You don't quite make the 717 or the 5, sorry, 510. So you're not going for the top school, but you have everything else going on for you. And I have a specific question on the first essay of the first phase of the application, which is why do you want to be a doctor? And you mentioned something very important, which is don't be generic. Don't say you want to advocate for others or help heal. So what's your biggest recommendation for that personal statement? Because every doctor coming in, just like every engineer will say, you know, they liked building Lego when they were young. Every doctor wants to help people. What's your advice regarding your personal unique hook?
No, great. Basically, I would recommend showing like a kind of a more mature understanding of like, oh, I've experienced medicine. I have like some personal situation that kind of got me interested in this. Just something a little bit more specific as opposed to just saying, I want to help people. Like, great, why don't you be a firefighter? Why don't you want to be a policeman?
Right.
Yeah. So just have like concrete examples. Like it's all about just being genuine, specific to you. For example, for me, like I said, I shadowed surgeons in high school, and I got a great mentor, and I told him like about great experiences I saw that kind of made me and reinforced my idea that I want to do this for a profession. So I talked about that a little bit. So I think those kind of situations are best. You definitely want to like, don't say like, oh, I hate people. I don't want to do that. I want to be a pathologist and never see a living person in my life. I mean, that's not what you want to put on your essay, but you still want to convey that you want to help people, but you want to have concrete examples why, and make it a little bit more personalized and specific. That shows that you're mature, you've made a rational decision, and you don't have this like butterfly view of like, oh, I want to be like Grey's Anatomy or Scrubs or whatever the current hot medical drama hit or etc. Or like Doctor Strange, some superhero movie. So yeah,
don't do that. You said.
Yeah, don't make it sound like you have no idea what you're getting yourself into.
Got it. And do you consider it like poor taste or childish to go back to childhood, or just focus on high school? Like, oh, I used to play doctor all the time with my stuffed toys. Like, do you want to skip that child bubble?
I think that's a little like, I wouldn't go that far playing doctors
Okay.
with toys unless you have like a meaningful experience in your childhood, like you
Yeah.
had a disease, you spent time in a hospital as a kid.
Yeah.
That kind of gave you an experience. That is more legitimate. Playing doctor as a toy, no. That's
Got it. This is super, super helpful. Michael, do you have a question, or shall I continue?
I don't have any at the moment. I'm not sure if there are other like high school students who are in the room as well.
Yeah, how many? What's our?
Yeah, we have a few. Sorry, go ahead. You've been raising your hand for a while. Sorry, we have more.
Yeah, no, I was just curious how the polymer that you
Mhm.
are working on identifies the cancer cells.
Very good question. So actually, that's the old model that we used antibodies. Now we have specialized peptides that link to a specific receptor on the cancer cell. So we have a series of peptides, one that helps cross the blood-brain barrier, and then a second peptide that's a targeting peptide specific to the type of cancer we're looking. So it's dependent. We have like something called angiopep2, which is specific for cancer membranes like glioblastoma and so forth. And we also have like a D3 peptide, that's what it's called, that's specific to normal healthy neurons. So that one we use to shuttle it directly into a neuron for like Alzheimer's treatment because those neurons aren't pathologic. So yeah, this is great stuff. And like I said, I'll be hopefully applying for NIH funding. Once I get established in the lab, I'm going to be opening this up to students to come work in my lab, and maybe you guys can update my videos and make them a little bit more high tech. But yeah, definitely. I worked with many students. I mentored many students through the medical route, through both college, medical school, residency, and so forth. And I work with many students in research. So I'm definitely going to be opening this up in the future once it'll get a little bit more established. Yeah, sorry, one more. Go ahead.
Let's say you're attending a college that it's like it's rigorous college where like you have bad grade inflation.
Yeah.
Are you at a disadvantage when applying to med school, or do they recalculate GPA?
They don't recalculate GPAs, but for example, like let's give me an example of that from history. Like I heard my friends went to Caltech, which is known to give like the class there abysmally hard. Like it's kind of like Harvard Westlake style. Like a lot of people pull C's and they're like geniuses, but then they get like 99th percentile in the MCATs. Like certain schools carry that reputation. If you're like an MIT, Caltech, like those places, the school's name helps you get a little bit, like they take that into consideration a little bit. Of course, like if you're like a 2.0 average, doesn't look good. But if you're, for example, like, like mid threes, like 3.5, 3.4, but then like you crush your MCAT and you're coming from one of these good schools, like that's probably going to be taken into consideration. Not by every school, but definitely some schools will like look at that and be like, okay, well, like their GPA is not that bad, but look where they're coming from. They're not coming from like, I don't know, University of Middle of Nebraska or something of that sort. I'm no offense to that university. I just like some place that doesn't have a reputation or an unnamed place with bad grades. Like if they come from like, less ideal grades from a super high competitive university, they kind of understand that you're competing against people who are like next level, not just like kind of the general college populace. So again, that helps. It's not going to put you at a terrible disadvantage. That said, still don't let that give you an excuse to do poorly. Like still do the best of your ability, but also don't drive yourself to depression, anxiety, and so forth, because that's going to actually hurt you in the long run. Yeah. Sorry. Any other questions from the students in the room? Sorry, good.
Do they know what percentile you're in somehow, or
for like the MCAT?
well, just for like GPA wise for your school?
There's something called the MSAR, or I forgot what the acronym is, but it's a PDF you can get on the official American Medical Association that shows you kind of the average GPA and MCAT per school of admission from the year, probably usually a year or two prior. That kind of gives you an idea of what the average GPA is for that school, like the median of the admits. They show like people who applied and who got admitted. So you kind of see the numbers. Essentially, the kind of the quote unquote magic number, again, there's no such thing as a magic number. Everyone's like, try and get a 3.7 and above GPA. So like basically an A- average. And some medical schools, like they don't care about the minus plus this stuff. Some of them like calculate it like that. Kind of like in college, every school has their own little shenanigans they pull. Some schools only look at your last 2 years only because they kind of forgive your freshman year, etc. But in general, like freshman year is actually the easiest time to get good grades. So a lot of people like go to college like, oh great, freedom, I can party and like like go out partying with their friends the night before the test and then bomb their test the next day. And like college, that's not going to be forgiven in a college. And then you pull like a B on a like freshman biology where you could have easily pulled an A if you like didn't do that. That's a bad idea. I wouldn't time like then you have your friends and business majors who are partying all night and they're like, oh, you're lame, you missed out. But you know what? At the end of the day, they're going to be your patients. So yeah, it's all about delayed gratification. You'll still have time to enjoy a social life in college as a pre-med. Don't worry. You just have to time it well and organize it well and kind of prioritize your schoolwork, and you will still have time for all the good stuff. Don't worry. Okay. Sorry, I went on a tangent there. Any other questions from the students? All right. Sorry. Any more from parents and Michael?
I'm all right for now. I appreciate you sharing your story. I'm actually applying, or I'm going to be going to a post-bac in the future, so I appreciated the little shout out.
Of course, yeah.
Okay. I just want to apologize to the students in the room. I came in late to Zoom and I did not see you, so I'm so sorry I went first with the questions. One more question, if I may, but anybody can.
Fire away. Yes.
What if your teenage daughter wanted to pursue medicine? What field would you discourage, specialty would you perhaps discourage her from, if any? Speaking practically.
Practically, none. Everything's possible. I have many, I mean, in general, surgical residencies are a little bit more demanding. And like if her priorities, for example, it's a little unfair to women in some cases because they're kind of usually burdened with like childcare and so forth, kind of in how society works, and they have to be pregnant and they have to go through maternity leave and so forth. That kind of sometimes doesn't look favorably. Yes, surgical subspecialties are not as good for that. That said, things have changed significantly in kind of recent years, even in like the decade I was training, that this is a lot more accepted. This is a lot more like understood, and people make specialized accommodations for that versus in the past, like in early 2000s and 90s, 80s, like, oh my God, that was taboo. Like things of that sort. So like, I don't think there's any field that discourages women or anyone from applying to it. It's all what you have to find a field that you're passionate about. Everything else will fall into place. Yes, every medical field is going to be very demanding. It's going to be hard. Like you have to plan things around your job as opposed to planning your kind of like your job around your life. In medicine, you kind of have to prioritize your career. That said, you have to also think about the partner you choose in life. Family support is very important. Like you can take a much worse program, but for example, it's the same city your family lives in, and that support system is going to be imperative for surviving residency and training and even like or medical school even. That's going to give you such a huge leg up in like your well-being and even like let you start a family, be much more successful and achieve everything you want to do. And at the end of the day, every medical school is going to get you basically the same standardized education. You're not going to be limited. You're still going to be a doctor. You can still practice in any field as long as you do well. There's nothing I would discourage anybody from doing. And I have many, actually, female surgeons are now on our surgical residents are more common than male surgical residents now in today's day and age. But the change is recent. So like there's, I would not have any discouragement for anything of that sort.
Thank you.
Yep. Okay. Any other questions? Go ahead.
I don't know. If somebody wanted like research experience, like I mean, I'm a high schooler, obviously. Would you recommend just cold emailing people? Or
Absolutely. Cold email. You can also look into like some like UCLA, USC, Cedars-Sinai. They have some a little bit more organized programs sometimes. Research is, and I think they have some labs offer internships. There's always a little bit. There are some like age requirements. Sometimes in certain things you have to be like 18 and older to do things, especially if you're doing like medical research, like patient care research and things of that sort. There's some like legal ramifications, like you can't be like under 18, you can't come into the operating, for example. Like they don't let you, no matter how good or mature you are. That's just by law and like hospital policy. But in some of the research aspects, they don't let you do as well. But that said, definitely cold email, definitely research. Like we have a lot of like resources up online that were previously you had to like cold email, like look up in a phone book and so forth. Okay, I'm not that old, but still, I'm just saying like the information is much more readily available. So just look it up. And like I said, the ones who kind of look for it themselves, find it early and get it earlier, those are the ones who will succeed. Yep. Okay. Any other questions, Terrence? Okay. And in the future, anything that you guys would like, if I was going to give this talk again, anything you would like me to cover in the future or anything of that sort, or something that I should take out of my presentations in the future, I'd love any feedback. Feel free to message me, email me, or tell it to my face. I don't care. I'm open to this. I just want to make sure that you guys are getting the information you want out of this. I sometimes ramble. Okay. In the meantime, otherwise, thank you, everyone. They have my contact email and contacts here. So if anyone has questions, feel free to reach out to me directly. Yeah.
You were perfect and insightful. Thank you so much.
Okay, thank you so much. Appreciate it. Okay. Have a good one, everyone. And of course.
Sorry. Thank you very much. I just wanted to check in. Are you giving the presentation on Cedars today?
Oh, not. I think it was kind of wrapped into one presentation. But if you have any specific questions about Cedars-Sinai, I'm more than happy to answer them.
Oh, okay. Well, it was just interesting to me to like hear your story and see how you progressed.
It's kind of more like the more you work around the same center and get to know the same the people there, that's basically going to give you a leg up of finding a job there eventually. That's basically all it is, having building that connections rapport. I was at Cedars-Sinai since high school. Full disclosure, my parents did research at Cedars-Sinai back in the day, so I got a little bit of introduction to some people to get this stuff. But that's not a significant advantage. I'd say it's just more of they told me to instead of going UCLA, USC, we have some friends here. Why don't you take a look? You're interested in this. They got me the kind of introduced me to people that I wanted to work with early on in high school, and then from there on, it's kind of it just took off by itself.
Okay, very neat. Yeah, I appreciate it. It was interesting seeing where you had gone, because my dad had done his residency at Cedars, and he used to well, he's still sort of teaching at USC in the medical program. Yeah. Awesome. Anyway, thank you very much for the presentation.
Of course. Have a good one. Okay. Let's sit for Zoom call and fire away questions. Hi, Vlad. Nice to meet you.
I'm Audrey. I was just wondering if you have any specific advice for high school students, because I know it's a little different once you're in college.
Yeah. For high school students, like I said, the teen volunteer programs are probably your best bet. Those programs, they kind of let you you do flower delivery of patients. You get to work a little bit with patients. You get to understand how the hospital works. And eventually they can kind of let you transition to shadow some physicians. Sometimes they do it up front. I was in a doctor's office filing these medical charts, because back then they were paper charts, now everything's electronic. But I was just sitting there in the back, and then it's who are you? And walk around, oh, I'm this, I'm just doing filing. It's you want to see something cool? I'm just come with me. And it's something of that sort. That's how it starts. You just show up there every day, and then one day, you're nice to the staff, or they kind of throw a bone to you, hey, doc, this is a student who's interested here. They're here, they're filing records for the last 2 months. You want to show them something cool? And doc's oh yeah, of course, yeah. That's how it kind of starts. Yep. Yeah. I think the teen volunteer programs, you're probably they have lots of those in Cedars, UCLA, USC. Probably some of the other smaller hospitals, etc. They have all those outreach programs. That's the best way to start. And then same thing, you can Google any interesting, you some bio, some chemistry, some engineering. Those research areas can also you can find professors who do that stuff.
Do you have to apply, or can you just volunteer?
Well, you can volunteer, but you have to there's a application portal to start that. So there, and some of the stuff are a little bit more competitive. There's a wait list to get into those. So we have a clinical shadowing program. They sometimes they're reserved for college student pre-meds. They require 200 hours volunteering, and there's hundreds of people who apply that, and you only have X amount of slots because X amount of faculty volunteered to do this. So those are competitive, and you have to it's how early you apply gets the wait time can be over a year, especially for summers when most people have free time. Okay, cool. Yeah, any other? All right, good.
No, I think that's good.
Okay, sorry, go ahead. whoever wants to come next. Yes.
Hi,
I'm
I'm
Vlad. Nice to meet you.
Can I ask you about research at Cedars specifically? I know Cedars, they have the Inspire program, which is like for high school students, they get to go in. But I got rejected this cycle, and
Yeah, it's super competitive, and it's also like on a waiting basis. So like sometimes they reject you because it's already filled. It's not because of you're not competitive or anything. So it's just keep trying. They will eventually open up a spot for that. Because I didn't know how competitive it was until recently, where I had like a high school student like cold email me, and I was like, oh yeah, absolutely, let's go shadow it. So I called the volunteer office, like, hey, I have a high school student who wants to shadow me. They're like, they have to apply, it's already done, it's booked out till like 2026. I'm like, oh shit. I'm like, okay, did not know it was like, it's like I can see them, like, can they bypass the line from going directly? Like, nope, not a lot. You can't, there's some red tape that you can't like supersede. So those are definitely some things that, like I said, there's also like private things that like certain like labs organize, or that were organized in the past. I don't know how it might have been like all like institutionalized, made like a structured program that you have to apply to now. You can't like individually work, contact like a direct lab. But obviously, if there's a lab or like a person that's willing to work with you, and like you email them like, hey, I'd like to work in your lab. Would you like permit me to work in that lab? Then you say, hey, I got a like written like acceptance from this lab to work with them on this project, and then kind of go from there. That will help you a little bit. Hopefully expedite.
that's because I know a guy, he's a gastroenterologist. He runs a lab over there.
That was the name.
Dr. Gadam. And from my understanding, like if you're under 18 and you're not in the Inspire program, like they don't let you actually go.
Maybe not. But like just having that like at least connection with the person, the mentor who you want to do research with, may at least tell them like, hey, I have a certain person that wants like I is permitting me to work with them. I would like to apply, and just like basically look what the cycle opens and reapply it immediately after you get rejected. And then say like, hey, I'd like to apply. This is the person that I already spoke to. They said they would be happy to work with me. As soon as I'm allowed in, I'd love to do this. Yeah.
So like, do you think like right now, even if like I have to like do like virtually, do you think there's like some way into like doing research like with the group?
Potentially, I mean, you can reach out to the person. Like, there's a lot of like literature review stuff that they can make you do, kind of like such like a fancy book report on the topic they're writing for a paper and so forth. And they say like, hey, I have a project. Can you look and get me like a research report on like, this topic? Because I'm writing a paper on cutting edge research for this part, but like show me all the background for this. So I think that's what a lot of medical students and like undergrads like, reach out to like other states. Like, hey, I want to do research review. Like, what can I do for you? And I'm like, well, I'm writing this review paper, which is basically like a summary of the current literature on this. Work on this section. We'll add you into the research. Like those are things you can start doing early. And you can reach out to like that GI doc. Like, hey, look, the Inspire program is currently full. I'd love to work. Is there anything I can work remotely outside of the hospital, like directly, like a review, like a review paper or something of that sort? That's something that you can kind of pursue. That might be like your little avenue in. And even if they like just let you do it and they don't like give you credit for it, etc. It's more of like already getting your foot in the door. So when you get there, you kind of hit the ground running.
Yeah. I have another question about like applying to undergrads that have med schools. Like, do you think there's an advantage to that?
Somewhat, yes. It's more just like you're in proximity with the medical school faculty. So like you work in a research lab, like medical school, for example. Like you already have some FaceTime with some of the professors, and they may like them putting in a good word. Like for example, like you work in the lab all through undergrad at the medical, like professor of medical school. He like knows the admissions committee. He's gonna say like, hey, oh yeah, this is my boy. Like I want to enroll you. I work with them. I train them. Take them in. Like they're solid. Like that's gonna help you a little bit, but not like I wouldn't say it's a massive advantage. Yeah, sometimes it could be a disadvantage because they're like, if you don't do well at that school, they'll like X you out right away. So I mean, there's definitely some favoritism to their own school. Like they have some patriotism. Like, oh, okay, this school we think is rigorous. So if you do like well here, you're probably going to be doing well in your classes.
I would say.
Yeah. So
I have a friend.
Anything else? Or
Thank you. I appreciate it.
Yeah, of course.
Nice to meet you. Good friend in high school.
So I'm interested in studying like biomedical science and biomedical engineering. And I'm also
He was very much in the
research
middle
at these
city
stuff.
kind of in Boston.
But I
So
was
it's
just
very
wondering
much
if
an
you have like,
environment.
I mean, I know you
Not much of a
touched on it,
campus
but if
really.
you have like that's
Call.
be persistent. It takes time. Like, I've been in for years sometimes. And
UCLA.
like, oh, it's not opened up. I'm like, well, someone emailed
I've
like
taken
years ago.
classes
Like,
at UCLA
yeah, I'm like,
myself.
email this. Oh yeah, this is a great
Down
opportunity.
here,
It's not been It's all about just being persistent in delayed gratification. So just keep doing what you're doing, and I'll think it'll fall. Like, the ones who keep knocking on the door, those are the ones who are going to get let in. It's not going to randomly offering something you're not already like. So I think that's the best way to do it, and like continue applying these programs. Like, there's a lot of people applying them there, and there's limited spots, so they're always in it. And sometimes there's no rhyme or reason why they accept someone or someone, especially the high school programs. Like I'm sure many labs would be very happy to have a hardware student because you guys are. The school's a little bit more rigorous than an average high school.
It's very good.
Like, the students who come from like the school, like I know it's like on a whole different level. Like college students, not high school students, like in labs. So in my own personal experience.
Some good opportunities.
So yeah, I think it's just keep trying, and then also helps. Like there's a lot of
I mean, if you're interested in
classmates whose parents work in these hospitals, and to know those parents are like, hey, I'm looking for this.
I think UCLA.
Some people like just use connections, like kind of use all your resources.
All of our
Yeah.
Because I know I missed like the first.
like I said, both my kids
but,
born at UCLA, my
do
doctors
you
here.
work in like a lab?
I do. I have my own lab, but it's still in its infancy, so I don't have like
You probably has been in school too.
I'm not having any students join right now until I kind of
It's
get
not,
an
no,
extra
it's
like
not.
like have a lab working there 24/7, like with my own staff there. So once I have that, I'm gonna start opening up.
Well,
more
so she didn't like
Do you
Berkeley when she
know
visited, did she like UCLA? I mean, did it feel different to her?
I know many labs that host students, but like I said, I think it has to be done through a program. I know unfortunately a lot of them are not like some of these are not as friendly for high school students as they are for like college students. There's a lot of college students and pre-med students who come work in labs. And
It's very
there it's
hard.
best to find a way that you do college like class credit for those.
My
Because
top
otherwise they
student
have to
last
pay you.
year.
Yeah, but if you do it as a class credit, they write you like a letter of recommendation, like an evaluation, and they don't have to pay you because labs are poor. They don't have money to spare for teaching.
So
Like,
it
they
is,
can't pay you
I think
and teach
it's
you.
very prestigious.
Like, so they have to, so they're never gonna accept those students.
And
So
it's
that's
especially
why
hard
they wanna hire like an
here,
actual
so.
technician to do all their experiment on it.
Yeah.
But you get as a class credit, the lab doesn't have to essentially
She doesn't want.
pay to support you on top of that. That's a huge deal. Like that lab's gonna take you much more. And when I was doing this, like you can volunteer in a lab, no problem. But now with like California labor laws, they have to pay you or give you class credit.
I think
So,
it's fantastic.
so that's one thing. Like if you want to like to find your way into more labs, make sure you go to your school and say, like, I'm getting class credit for this. So and, I will need just an evaluation, but it's free. You're not gonna put that in, like, explicitly in your email. Because the lab professor would be like, oh, a student I can't hire. Like, oh, they're free labor. Yay. I'm taking an intern, essentially. That's how things work, unfortunately. Yeah. So that's probably my best advice on that.
Okay. And also, I don't know if you already talked about this earlier in the
Yeah,
presentation, but
I would tend
what
to-
was it that you did?
She has to make her own
in,
decision.
like what?
Oh, so I did.
Very
I didn't do any research in high school. I started my research between high school and college. But I volunteered at Cedars-Sinai, just like a team volunteer.
Oh yeah, I'm actually did. Or I did that last year. I'm doing it.
Yeah, so keep doing that. Once you get like 200 hours, they can give you like pre-med shadow and stuff. Like they have like you can do more stuff. But that really helps you. First off, it gives you the experience for college that helps you, and then you already have your foot in the door of volunteer there, so you can get more fun.
Where do you guys live in LA?
Okay.
Yep.
Okay, thank you
So yeah,
so
you're
much.
doing the right thing. Good job. Thank you.
Okay. She'll move back to LA. She'll stay. Thanks. That was a good talk. Thank you so much for your time. Yeah. Good to see you. Of course.
Yeah, we were just talking, I was just gonna say, just kind of ask you about this. My daughter has two choices right now. One is UCLA, one is BU. We don't know much about the yeah.
Yeah.
I
I mean, I don't think there's any advantage one over the other. So there's no, I wouldn't say there's any advantage. I'd say college is a stepping stone to medical school. If that's the route, kind of the route you want to do. So it should be the focus, and the certain one basically use it to save money, but it's not. Right. Yeah. BU I think is going to be much pricier than UCLA because we're
save the money.
Save the money because it's really paid for it.
Did people feel like their financial aids are easy or no?
It depends.
Right.
Yeah, they some do, some don't. But like I said, those are extremely competitive, and usually from med school and kind of suck up and pick up a position. So you're kind of in veterans life for until you're 50.
So how long have you been a professor?
Just this year. I just finished fellowship last year.
So you still have like hundreds of $1,000s of debt to pay off, basically. But you'll get
Yeah. Unfortunately, neurosurgery is one of the higher paying specialties.
Sure, yeah.
So pay off a little faster, but to get there, it took so many more years.
Did you know that our assistant head of school is having brain surgery
Yes.
tomorrow?
Yeah, people are actually going to be doing it.
Yeah, I was gonna ask about that, yeah.
Is that she's doing
an
a-
meningioma, I think it's
Yeah.
called, does that sound right? It's a benign tumor? Yeah, we just found out about that, she just,
Yeah, it was
had a
okay.
seizure, I don't know, I don't think they've sent that information out, but it is in Cedars, I'm pretty sure.
It's one of those 5 people who do it.
Okay,
Yeah.
okay.
I
It's not you.
well, I didn't.
But you should do it.
I definitely could do it. I do it. So Cedars has a big group and they have a few satellite hospitals. So the junior faculty is usually at the satellite hospital, and senior faculty stay at the main hospital.
Okay.
I actually have subspecialized training in certain neuro-oncology procedures, so they call me up to help them. But they still take the role.
Okay.
But that's as a young guy, you're like, okay, I'll sleep the kind of like tell you about this one, just help out, and then build in my practice. And probably like, once I get more NIH funding, get more of a reputation in the field, I'll eventually just, and someone retires and it's fine.
So you must have been a new sophomore here when you.
I started.
So where did you come from?
Campbell.
Oh, okay, you came over from.
Yeah, I did 2 years Campbell for that months.
Got it. Yeah, because I can't even look up your grades anymore. The software we use for chemistry grades back then. It's very gone. I was kind of curious.
I ended up with a D.
I'll bet you did.
Yeah.
All I could
But
find
I
is
started off
this-
like I like crashed and burned. I came
Yeah.
too hot.
That's the only thing I found was a comment, because I had to write comments for, it's only 3 of them, and I figure it must have been the new sophomores, because I think I had to write comments for anyone who was a new sophomore.
Yeah.
And yeah, it was basically, discipline, clearly really interested in learning, but needs to, kind of rough around the edges.
Yeah.
That was basically what the comment was. So
Yeah, so I love really, I read a lot of the popular science, and I kept asking you those silly questions, and you're like, no, it's smaller, like it's so abstract, like quantum mechanics, like how is relevant? You're like, okay, fine.
Well, you took our hardcore physics classes after that, right? You
Yeah.
took mechanics and
Yeah.
stuff like that.
Yeah,
So you
we got
must
them all together,
you
like-
must have been a pretty strong student.
Yeah, I did like I crashed and burned my sophomore year at Trinity School.
Yeah.
The regular Campbell like exponentially higher. Campbell was like a star student, like it was
Yeah.
230 was easy. And
Right,
and I decided to join like all the sports team. I joined waterpolo team.
Oh, okay.
And like
Okay.
completely overloaded myself, like stretching myself super thin, and just like crash and burn. And like second semester of sophomore year, I'm like, I should probably start.
It's good training for med school though,
Yeah,
right?
exactly. And then junior year, I got the student council. I got
Oh, yeah?
like I got my act together.
Interesting.
Got much better grades. And,
Forgot.
Yeah.
It's too long.
but yeah,
ago.
I crashed and burned sophomore year.
You're basically the age now that I think I was when I talked.
Yeah.
You're 35, something like that.
Yeah.
34.
Yeah, exactly.
That's
You
probably
just started.
exactly
Yeah.
what I was.
You,
So.
you were the brand new professor that started it.
Wasn't quite. I came here in 01 and I think I taught you in 04 maybe. So I've been here a couple of
Yeah,
years, but not much.
I know you and Dr. Dawson, that you faculty.
Oh, Dr. Dar, yeah, I
Or
still
you
see
were
him.
back.
I still see him. Yeah. Did you have him as a teacher?
I
too?
did not,
No,
but
okay.
I knew of him because sometimes
Yeah.
I think he covered for you a couple times.
That could be. Yep.
I think I started teaching like there was a long line, so he's like you're splitting students up. Like,
Okay. Yeah, he taught honors campus class. So
Yeah.
Anyway, well, good luck.
Yeah.
I'll see Mijo tomorrow. But I guess is tomorrow May 1st? No, tomorrow's tomorrow's the day. Huh?
Yeah, that's it.
Wow, tomorrow's decision day. Wow. Okay. Great to see you.
Yeah,
Thanks for stopping by my class.
Thank you so much.
Yeah,
I feel like it's.
100%.
All of that.
I mean, yeah, 100% about money. I mean, like one exception would be like, for example, it's like DU and UCLA, I think, are comparable to yourself. If you're talking about like Harvard, Stanford, like some of those things, sometimes a name brand gets you a little bit more, but not significantly more. So I'd say it's pretty easy.
Yeah, basically how.
Unless again, it's all there's some things they actually
Yeah,
have to do
that's-
school and stuff. It can be a program that like a combined program.
Thanks for being
Be
here. No problem.
otherwise, okay, so I wouldn't think twice.
And then I'm sure you've dealt with a lot of UCLA students. Isn't it really hard for UCLA pragmatic opportunities and all that, or is it just an issue? Or it doesn't matter. 'Cause
Yeah.
you have to.
You have to do it anyway. So it's an initiative everywhere, and every school, especially pre-med classes, are always overcrowded. There's always a line. You don't always get those classes. Like you apply for those classes, they're like, oh, the class is already full. Sorry, take it next semester. Next year. Yeah. It's the same thing everywhere. Usually works a little bit in public schools and private schools, a little bit larger classes. But I think that again, I took a lot of some of my classes at community college, and sometimes I literally like the class is full. I just like feel like screw it. I'm sitting in the front row, interact with the professor every day. And they're like, well, you're not officially part of my class. I'm like, well, I missed the deadline. Like, well, you're the only one who actually pays attention. So let me patch you there in the back door. And then they said, oh, slot opened up, somebody dropped out. You're here. So sometimes literally I spent a few weeks like in a class gambling. I would do it.
Yeah, very quickly because this is exactly what I wanted. I got in one call at 2:45, so
of course,
and had on the rest of the parents, on the rest of the students, on the rest of the one interacting and feel about something so valuable.
Yeah.
Please go back to it. Continue.
Of course. Of course. Yeah, listen, I hope we can do this more often to the students. So if there's anything you guys want me to cover next time.
Thank you so much. So finding a mentor is just kind of
yeah. You have to kind of search for that. UCLA has plenty of opportunities there, but it's more you have to like if that's the route you want to do it. The earlier you do it, the more likely you're going to get the mentor in time when you need them.
Yeah.
Because sometimes it can be like, oh, my third year, like I decided to go pre-med, and I want to start shadowing a doctor, working in their lab, and so forth. But my application's in 3 months. Like you're not going to find it. That's true. If you do it from day one, you start looking for a lab and like knocking on doors. Probably the first year you might not get anything. Everyone's gonna be like, no, not interested, not interested, full, etc. And eventually, but like you keep leaving your name, you keep like emailing these professors and so forth. And eventually, one is like, oh, it's persistent. That means probably they're going to take it seriously and do it. And sometimes how break in the door. Obviously, the daughter must be smart. She's a car blessing, so it shouldn't be. Yeah, you understand. So, thank you. Yeah, of course. Yeah, of course.
Thank you for your time. Thank you.
Absolutely. Which field are you in?
Oh, I'm like a designer, and she used to love like music and all that. So none of us know anything about like treatment. Kind of like a lot of books that you put up. I think she read at least 3 or 4 of them, and then maybe not one of them, or maybe all of them. So she just kind of read her.
Yeah, no, that's how you start. As long as you're interested, like medicine is hard enough, right?
She gets excited, so she does the shadowing thing, and when she sees like the brain stuff, she gets excited. So I'm like, I guess it is what it's just to tell me how it looks like.
It's exciting. It's hard, but I think at the end of the day, it's worth it. You just have to realize there's a lot of ups and downs, and it's a very long road. And as long as you kind of keep that mindset, it's all for the greater good. At the end of the day, and you just have to survive like all these stages of training. Eventually, it's gonna be good. Yeah.
Thank you so much. Thank you.
It's amazing. You get to control around. Yeah, like trapped inside this.